Patients are more likely to implement self-care tips that are simple and easy to make part of their daily lives at home, at work, and when they're traveling. Every patient has unique challenges, and we may need to help them individualize their own self-care routine. It's very important to explain the muscles and joints that are being stretched, where they are located, and why restoring proper movement, their symptoms can be improved. To establish and maintain proper posture and gait and other movements, the muscles throughout the body must be able to completely contract, relax, and lengthen. The cervical and thoracic spine must be able to flex, extend, and rotate. The ribs move properly, and the scapulas fully retract, protract, elevate, depress, and rotate on the rib cage. All of the joints throughout the body need to properly move as they were designed. Let's take a look at a few ways that we can help our patients. As a visual aid, I'll use the videos as we've just looked at. We'll take a look at the posture charts. I'll also use anatomical models. I even will utilize a slinky to help the patients understand the movement of the rib cage and how we need to get the ribs moving and get the spine moving and how they're going to affect the positions of the vertebral column. We also want to help the patients understand the movements that take place throughout their vertebral column. And next, we want to show them the movements to perform daily to help maintain good posture, normal range of motion in the joints throughout the body. And I'm able to communicate to my patients with firsthand knowledge and experience. So I show my patients how I stretch, depending on the environment, whether I'm sitting on a chair or standing, holding onto a desk, a table, a countertop. Let's take a look at a few things that we can do to help our patients stay mobile throughout their day. So, one of the first things our patients always are asking us is, should I start an exercise program? Do I need a trainer? And really what they need to do is just start some simple range of motion. We want them to start first thing in the morning. They can start that in bed. I like to show them things that they can do, whether they're at home, on vacation, at work, maybe out of town for a wedding or taking care of family of some type. People need to maintain their range of motion, and it's typical during the most stressful times in their life when they start to ignore their bodies. So there again, while they're traveling or at home, I suggest they just take an extra flat linen or a sheet and put it on the floor in the hotel room or wherever they're at. I use a professional exercise mat. It has some nice cushioning in the clinic, and then I'll put a linen on top of the exercise mat. Of course, if the patient's older, I might have a patient 93 years old coming in with a walker. I'm not going to have them get on their hands and knees on the floor. So things can be modified. But there again, I want them in a safe, stable environment. They can do some of these on the treatment table. I just think it's just going to be better if you put them into a situation or onto a floor just like they'd be at home, or they could imagine that this is their bed in the morning when they first wake up, and there again it would be smart for them to apply some of these techniques at the end of the day. Throughout the day, again, everything is being flexed forward typically, and we want to lengthen, move these joints throughout the night. They probably, many of them sleep in a fetal position, or they sleep with a pillow under their head and some type, maybe a pillow under their knees. So again, that rib cage is flexed forward throughout the evening, and we maintain this flexion position throughout the thoracic and lumbar spine, and it's just not the natural position for the body to be in. So I'll just take an exercise mat, I'll put it on the floor like I said, I'll put some type of linen over it, and then I explain to them, these are the same things I do for myself every day. What we want them doing is going into these movements. Notice as we're doing this, I'm getting flexion and extension throughout the cervical, thoracic, and lumbar spine. I also have the innominate bones, the pelvis moving through some of the natural movements that it needs to go through as I'm ambulating, as I'm walking, gait. Also, the shoulder blades, notice how they're protracting and retracting, moving around the rib cage. Again, we've got to make sure people are able to perform these movements. What you're going to see is a lot of your patients will bend their elbows. They're not even used to taking their scapula and moving it around the rib cage properly. Also, if they can move back, some of them are going to, if they're carrying extra weight, they're not going to even be able to do all these movements. And initially, it will even cause them to break into a sweat. So basically, they're using their own body weight, but they're going through functional movements that they would naturally go through throughout the day. As soon as they get up, they're going to start reaching into the medicine cabinet, into the refrigerator, into the cabinets. They need this proper range of motion. They're going to start to drive. They can sit on the side of the bed. Of course, our patients, a lot of them, they don't have the range of motion to maybe sit cross-legged, but they could sit on the edge of the bed. They could sit on a chair in the office, some type of stable platform, and we want them to twist, taking a breath in, exhaling as they turn. We want to get this movement in the rib cage again. We want to get the movement in the rib cage. We want to get it through the vertebral column. Again, they're going to get up and they're going to start to drive their car. They want to turn to back up. These movements should just become part of their normal morning and evening routine. At the end of the day, again, after being at work all day or in the morning, some of these movements should be done at lunch. Again, as soon as they get home, you'll modify it. You can show them how to hold on to the bathroom counter and just lean back. Let's take a look at a few of those movements real quick. Now, once they're out of bed, they're going to start moving around. So we want them, again, whether they're in the kitchen or in the bathroom, they could utilize that counter or a chair or some type of high counter where they can try to keep a straight back and start to stretch their hamstrings, get their back moving. There again, these are very normal, natural movements that they're going to do throughout the day. Many times they need the support of the counter to even try to lengthen some of these muscles. So once they get stronger, maybe they'll start to integrate other things like yoga into their daily routine. But if we can just start to get them moving a little bit every morning throughout their day, maintaining good proper movement in the joints, things will just, we'll get them on a track of improvement. Remember, we take that posture photo because that's proper alignment for the body, just like the dentist shows you what a healthy tooth looks like. We need to show the people what is good health for the body, and part of that is proper alignment. And the myofascial tissues play a very important role. So we're going to utilize all the different tips. We'll educate them with visuals, taking still photos using videos. We'll utilize topical analgesics, stretching, ice, all the different ways that a patient can take care of themselves between treatment is how you will build your practice. I wish you the best.